Are you finding all the terminology when you had your breast surgery after breast cancer very confusing? A lot of people feel that way. So I'm here to see if I can help define some of those terms and make things a little bit easier. Hi, I'm Sherry from Twin Sisters Mastectomy Boutique, and this is part one of trying to make sense of all of those big, crazy words. So first of all, I'm not a doctor and I'm not a nurse, but I have been working in the breast prosthesis industry for over 20 years now. So I have a little bit of information that I'm happy to share with you. Let's start at the beginning. A mastectomy. What is a mastectomy? A mastectomy is a surgery that removes the entire breast. So you may be left with a flat chest, you may be left with a concave chest that is kind of goes in. You may be left with a little bit of flesh, and you may have a double mastectomy, which means that both breasts are removed. And there's a variety of reasons for that. It could be a prophylactic removal, which means that there's no cancer in the other breast, but they're removing it for safety, just in case. Or maybe you've had breast cancer in both breasts, or maybe you're just high risk. So there's a single mastectomy, which is the removal of one breast, or a double mastectomy, which is the removal of both breasts. There's also something called a partial or a lumpectomy. So what does that mean? That is when the entire breast is not removed, just part of it, or a lump is taken out. So they call it a lumpectomy because they scoop out a little bit, or a partial because it's not the whole breast that's taken off. So you're still left with some breast tissue. And that is really between you and your doctor and your medical history and your risk factors of, whether you're going to have a full mastectomy or a lumpectomy. And your doctor and your healthcare team will be able to give you great advice. So then, if you come to see somebody like me, 4 to 6 weeks after your surgery, I'm fitting you with a breast prosthesis, which is a really hard word to pronounce. So breast prosthesis and breast form are interchangeable words. You can use either one. So if it's easier to say breast form, and it usually is, that's what we'll use. So this breast prosthesis or breast form is just one example. They come in different skin tones, different shapes, different sizes. They are weighted so that it's about 30% lighter than breast tissue, but enough weight to give you full biomechanical balance. So you have weight on one side and it's evened out by the weight on the other side. Because otherwise you could have neck, shoulder, or back pain if you have weight on one side and not the other. So this is a typical breast prosthesis. It's made out of surgical grade silicone, which is piped into this polymer bag. You can see a little opening here that is sealed off. And you would wear this where your breast was removed. And again, you might have a single mastectomy or a double mastectomy. And if you have a double mastectomy, you don't always wear the same size prosthesis or breast form on either side, because depending on how the surgery was done, the chest wall might be different on one side to the other. The goal is to make you look even in even your tightest clothes. So this is a full breast form, full breast prosthesis. And then there's something called a partial breast prosthesis or a partial breast form. And again, they come in different sizes. They come in different shapes, different skin tones, and these are hollowed out. Okay, so you can see the difference. This one's full and this one's hollowed out. And this would go over wherever you've had your lumpectomy or your partial breast surgery. And what it does is it adds enough volume so that your breasts on either side are even. So the goal is to make them look even and, for it not to be noticeable that one side has been reduced versus the other side. Then there are swim forms. So swim forms are, as you can imagine, worn in the water. And again, they come in different sizes and they're kind of a clear surgical grade silicone, and they have a concave back as well, and that is so the water flows through. And they're a little bit different in consistency, but they're still very soft. If somebody were to give you a hug, it would feel very natural. Now, depending on what company is providing your breast prosthesis or your breast form, different manufacturers will warranty them differently. They're all made the same, but some say you can wear them in the water, some say you can't. And for the ones that say you can't wear them in the water, this is a good option. So you can wear this, or if you're just an avid swimmer and you want to keep one breast form just for swimming, this is an option. We have sometimes used this as a partial prosthesis just because it is the best option for a symmetrical or identical appearance. So that's an option. They're multi-purpose. Then there's leisure form. So what is a leisure form? A leisure form is a breast prosthesis or a breast form that doesn't have the same weight as a regular breast form. It's not made out of surgical grade silicone. It has a little bit of weight, but not a whole lot. And because you can't wear your regular breast forms sleeping, right? Because if you roll over it, you could burst it. They're very durable, but you could still burst it. So you want some options. Let's say you're traveling with friends, or let's say, you know, you're wearing a really cute nightgown and you want something in there. Or if you have lymphedema, sometimes you can't wear something that is fully weighted. There's a multitude of reasons. Generally, you do want to wear the full weighted breast prosthesis. When I say full weighted, it's 30% lighter than breast tissue, but it's the silicone breast prosthesis. But for some people, they just can't. So there's something called a leisure form. And these are basically rubber. This is rubber. I don't know if you can see that. You can see the little pits in there because it's rubber. And the rubber has a weight inside of it. I can feel it. If I press really hard, I can feel it. And that helps to keep your leisure form from riding up when you lift your arm. But it doesn't really provide great balancing in your weight. So again, you know, it's perfectly fine to sleep in, but maybe, you know, this is not going to be your one every day. It comes in this little cover that you can take off and wash. Because this is rubber, you can't really wash it. So it just slips right back in here and you're good to go. There you go. And it's not, it feels soft, but it's not quite the same as surgical grade silicone, but it's an option. Then there is something called a puff. So a puff can be worn right after surgery. And right after surgery, you don't want to have any weight on your body. You want to be kind to your body. You want to wait the 6 to 8 weeks until you're ready to be fit with your breast prosthesis. But these puffs are fine to wear. They're literally weightless. They may weigh like a fraction of an ounce. And they have fiber fill in them. So you can make them bigger or smaller. And you can put this in a mastectomy bra, for instance. And it's not a great look. It doesn't look completely natural if you're wearing something tight. It looks a little odd, but it will get you through until you're ready to be fit properly. So that's a great option. Some people choose not to wear this at all, but it might just give you that little bit of confidence in the meantime. So I hope that cleared up some of the terminology. Like I said, this is part 1. Part 2 will come shortly. If you have any questions, please leave them down below. I would be happy to answer them for you. And please like and subscribe, because the more information we get out there, the easier it's going to be for the breast cancer community. So like and subscribe, and we'll see you soon.